Hello everybody, welcome again. This is Dr. Karl from Infinity Health Direct Primary Care in Kenner. Thanks for joining us again. We had a recent video about high deductible policies and health savings account. And I would opine that high deductible policies are what everybody should have because that's what insurance is for, is to cover catastrophic things. And also because high deductible health care plans allow you to participate in a very tax favorable entity known as a health savings account. Now what I would do to explain this a little bit more is refer you to the previous video, but I'd also like to show you that how this interacts with direct primary care. I am a direct primary care practice. I do not work with insurance companies. I do not involve myself with the hassles related to that. What I do is I have a membership-based practice. And for 60 something bucks a month, a person can go to my practice and we can service them with a number of ways. One of the questions about an HSA, about a health savings account is, can I pay my direct primary care monthly membership fees using my HSA? Well, I have many patients that do pay through their HSA. I do not advise them. I'm not a tax accountant or a tax attorney or anything related to that. But I do know of many individuals who pay whoever the direct primary care physician is through their HSA. The question is payment of a monthly membership fee considered a qualified medical expense? Previous video I mentioned that an HSA, health savings account, is to pay for qualified eligible medical and dental expenses. So is a monthly membership a qualified medical expense? Well, membership fee in that sense is not specifically listed in IRS publication 502, which delineates those items. However, many people I speak to, including tax individuals and other physicians, feel that it's rather intuitive and obvious that membership as a retainer in a direct primary care practice model would be a qualified medical expense. But that certainly hasn't been clarified at 100%. As a matter of fact, when we have gone to Washington, D.C. and lobbied for certain legislation, the IRS has told us that they're not saying that a membership fee is not a qualified medical expense. What they're saying is we don't know. The IRS is saying we simply don't know how to categorize it. And if you please, speaking to us physicians, if you please, the IRS asks us to then develop some legislation which codifies it and puts it in writing to make it clearer for them so the IRS does not have to interpret a lot of this. So there was a bill a few years ago, the Primary Care Enhancement Act, which was very favorable from an HSA language standpoint. And that was morphed and passed as a different type of bill, but nevertheless a good bill. It was HR 6199 at the time. It passed the House of Representatives up in DC with great bipartisan support, and it was moved on to the Senate. At the time of this video, we're just getting over the midterm elections, so there's not a whole lot of legislative action taking place, as you might understand. Maybe none of that moves again until early in 2019. The HR 6199 is actually known as Restoring Access to Medication and Modernizing Health Savings Account Act of 2018. Now pay attention, because that may change names or may change numbers by the time it gets to the Senate, and it will start with SB for Senate bill. But nevertheless, that legislation specifically mandates that the IRS recognize health savings account membership fees as being a qualified medical expense and can be paid from a health savings account. That bill also does a number of other really good things and some stuff which needs to be tweaked, and hopefully the Senate will tweak that. So having a high deductible health plan, if you're an individual, allows you to purchase a cheaper policy. The premiums are cheaper if you have a high deductible plan than rather than having a plan that has a deductible of $500. So if you do have a high deductible policy, you're eligible for the health savings account where you can contribute pre-tax, and also it's tax-free as far as the earnings. Then whether you pay from your health savings account a membership fee in a direct primary care practice will be up to you and up to your own discretion. We don't give advice on that because that's not our bailiwick. But we certainly feel that in the very near future, it'll be very clear and simple so that if you don't already pay a direct membership fee from your HSA, then it will be very clear that it'll be something that is permitted, at least from the IRS regulatory standpoint. So that's a summary of where we stand as of November 2018. Things may change, but I don't suspect in the very near future. So I hope this helps some, and I hope this encourages people to take advantage of high deductible health plans and health savings accounts. If you liked our video, please like it or thumb up. And don't forget, after this, to subscribe and follow our future videos. Okay, thanks for listening again. See you next time.